Now, ductal and lobular carcinoma. What is the important marker? It is the E-cadherin, which binds with the cell adhesion molecules that are expressed on the epithelial cells. That's the reason it is only present in the ductal carcinoma of the breast instead of lobular. Why is it important for you? It's important for you because lobulars are the dirty carcinomas we don't want in the patient. Lobular carcinomas are bilateral, the metastases, etc. So it is more of ductal nature if E-cadherin is there. If you look at 922, which is the Philadelphia chromosome, it's not specific for CML always. It is also found in ALL and also AML also is what need to be fundamentally remembered. Now, in herpes simplex lesions, if you take a biopsy, what do you typically come across? Multinucleation of the keratinocytes, nuclear molding and chromatin margination, they are all the important features. In the case of herpes simplex infection is what need to be remembered. That's right. Now shoot me an answer, doctor. What is the quad screen in Down syndrome will show? You must say ID, I for increase, D for decrease. Alpha beta protein will decrease, beta HCG increase, estriol decrease, inhibin A, not sure. Yes, that's good. Dr. Dilip said increase, increase, decrease, decrease. And is the audio okay? Some of the students are not getting a proper audio. Just find out. Just please type whether audio is clear or not. Yeah, Dr. Padmaja said decrease, increase, decrease, increase. That's right. Now it is clear. Okay, that's good. So, decrease, increase, increase, increase. Right? Beta HCG, inhibin A, both of them are typically increased in the quad screen. Okay. Now there are nasal bleeds, fever with cough and bilateral nodular densities. What does this basically suggest you? I think the voice is clear. That's good. Leukocytoclastic vasculitis is known to lead to palpable purpura, and vaginous granulomatosis is associated with positive C anchor is what need to be remembered. In this, the anchor being positive, you should always consider a leukocytoclastic vasculitis in this. Now, with regard to the myxoma, it's more common in the left atrium. That's the reason it's a common differential diagnosis for the mitral stenosis. Now, a 37-year-old is having a vasculitis which is involving the lung. What is a very important principle which you should not forget, doctor? Polyarteritis nodosa never involves the pulmonary vessels. It involves kidney, it involves mesenteric vessels, but it does not involve the lung vessels. You should review the vasculitis video in the medicine lectures. In the rheumatology medicine lectures folder, we have entire question bank about from the past 15 years. Already AIIMS-PGI is available. Vasculitis is one topic which is going to come in the tomorrow's NEET. Cryoglobulinemia, pan, Church-Strauss, vaginous, everything. You must be encyclopedic, especially when your teacher is a MD general medicine guy. If you do wrong in a vasculitis question, my soul will be heaving in the graveyard. Or what happened, we could not make you. So large vessel vasculitis like Takayasus, arthritis. Then you have medium vessel, small vessel. All these things you must be very sure. TTF1, which is thyroid transcription factor, is a marker of both the lung tissue and also thyroid tissue is what need to be remembered. That's good. Dr. Navya has rightly said, never in lung is very important thing to be remembered for the pan. Now coming to the spectrum of pathology in the crans, there is an involvement of terminal ileum, infiltration of the crypts by neutrophils and creeping mesenteric fat. In which condition do you have massive infiltration of the lamina propria by macrophages? In case of? Excellent. Tropharema vepli lead to the development of vepals is what need to be basically remembered. Where there is a massive infiltration of the lamina propria by the macrophage which lead to PAS positive substances is what need to be remembered. Now should be an answer, doctor. Which trisomy? Severe mental retardation, rocker bottom feet, prosencephaly, polydactyly, death usually within 1 year. Edward, 18 or 13 or 11 or 10 or 9 or 8. Let me see. 13, Madhavi Kranti say. Dr. Padmaja places her bet on 18. Dr. Vidya says 13. So doctor, it is Pataus, which is trisomy 13. कब से पटाना शुरू करते? 13 से. So trisomy 13. Puberty is 13. In them there is a but unlike the Downs, all this quad screen is normal in them, unlike the Downs. Now doctor, microtubule formation is basically inhibited by which drug? It is the grisofulvin, which localizes in the keratinized tissues, which will inhibit the growth of the dermatophytes is what need to be remembered. We use the fluconazole, which is very important in the management of the Candida fungimeus, and also the relapses of the cryptococcal meningitis is what need to be understood. Splotchy hypopigmentation is there. So what is your diagnosis, doctor? It is basically tinea versicolor, which is caused by Malassezia furfur, which is known to lead to development of hypopigmentation. Very common when you are working in a PHC, you will find lot of people coming with that hypopigmented skin, and they will be threatened by the TV news that it can be leprosy, it can be that, it can be this. It's a simple tinea versicolor which need to be fundamentally remembered. Now a premature baby, now 4 days old, has developed a white coating on the buccal mucosa. So it is basically Candida. Now amphotericin B is the one which is used to treat the life-threatening fungal infections is what need to be fundamentally remembered. Now shoot me an answer, doctor. Cleft palate, thymic aplasia, T cell deficiency, cardiac defects, velocardiofacial syndrome. These are all typically seen when which chromosome is abnormal. Which chromosome? I want the chromosome number. That's good. Our student Dr. Sudha is first to answer. Very big clap. It is 22q1 deletion syndrome, which lead to catch-22 is the name which is being given. The patient is a logger in the forest. He was receiving chemotherapy for the cancer, and now he develops large yeasts which are thick cell wall and broad based, makes you to think of blastomyces dermatitis. So you must remember blastomyces lead to double refractile wall with a broad base of attachment to the mother cell. The daughter cells will make an attachment is what need to be fundamentally understood. Now a HIV positive patient with a stiff neck, severe headache in a HIV positive guy, you should always think of cryptococcal meningitis to be underlying cause. Serious respiratory distress in a pediatric ward. That's right, Indian ink preparation and cryptococcus need to be remembered. So respiratory syncytial virus is the one which you need to remember for this question, which causes a serious respiratory infection in the case of the infants, and also can lead to nosocomial infections. Positive sense polarity. Which viruses will typically show their genomes which have a messenger polarity. It is basically a feature of polioviruses. Subacute sclerosing panencephalitis typically is caused as a late complication of the measles infection. Koplik spots are seen as a very early feature in the prodromal stage and SSP as a late complication. Dane particle and hepatitis virus genome, which you are going to remember. Coxsackie is the common cause of viral myocarditis. How many of you as a house surgeon has managed a viral myocarditis, doctor? The heart will be racing. Third heart sound of a failing heart. If you want to appreciate, follow a patient of viral myocarditis. Common differential diagnosis is acute onset of a congestive failure in any individual makes you to think of MI. So there is a sudden cardiac dysfunction, elevated JVP, pulsating heart with a third heart sound, with a racing ECG monitor in a patient who is having fever, high grade fever, viral myocarditis, Coxsackie B infection. Now, tuberculoid versus lepromatous leprosy. See, doctor, the difference is the lepromin test will be negative in lepromatous leprosy, and if you do the biopsy, you will find multiple steaming Mycobacterium leprae found only in the case of the lepromatous leprosy is what need to be appreciated. Gons complex and primary TB in the case of the children, you are not going to forget. Legionella typically is weakly gram negative, facultative intracellular and associated with the water in the water tanks is what need to be fundamentally remembered. And what it leads is a fibropurulent pneumonia, not a granulomatous pulmonary infection is what need to be remembered. Okay, doc, you have to give me a strong answer. Fomepizole inhibits which enzyme? Disulfiram inhibits which enzyme? Whoever correctly answers will get a Cadbury chocolate. Yes, fomepizole. Who will give me the correct answer? Which enzyme? And disulfiram is which enzyme? Who will give me the correct answer? That's right. Disulfiram alcohol dehydrogenase. Our Anantapur guns are answering the question. And Warangal says disulfiram is aldehyde dehydrogenase. Okay. Nobody is saying what will fomepizole will be doing. You never heard of fomepizole? Yes, doc. Tirupati need to tell aldehyde dehydrogenase is fomepizole or disulfiram?